In Health Watch, a new study has revealed only about a third of heart patients get the recommended amount of cardiac rehab. Beth Galvin explains how it can help out.
Cardiac rehab can be critical to the recovery process, and usually patients are recommended to get 36 sessions at about an hour apiece. But new research shows that many people, especially women, may be missing out on cardiac rehab.
If you've had a cardiac stent placed or undergone heart bypass surgery, Sherry Grace, a professor at York University in Toronto, says your next step should be cardiac rehabilitation. Most patients are recommended to receive 36 hours of cardiac rehab, usually broken down into 1-hour sessions.
So cardiac rehab results in 20% less deaths in patients that attend.
And Grace, who's an expert in cardiac rehab, says these programs meet patients where they are, offering not just a supervised, safe way to get back on your feet again, but heart health education, nutritional counseling, and mental health support.
About 1 in 5 heart patients have depression. There's really high rates of anxiety. You know, some anxiety is normal, right? You've just had a heart event. But those conditions really impact a patient's ability to follow the exercise advice and the nutrition advice. So the programs where that's addressed, the patients really do a lot better. Patients love it. Once we get them in the door, they are very happy to keep coming.
But a recent survey of about 2,000 heart patients from 16 countries led by Grace found that many are not getting cardiac rehab. Even in North America, she says, which has higher levels of participation in cardiac rehab than other regions, only about 30% of heart patients are receiving rehab.
Overall, the highest barriers were not even knowing that rehab existed, and then cost and distance. And so it is true in the United States, there's co-pays for each session. So that can be quite a barrier for patients.
And researchers found that women are less likely than men to be referred for cardiac rehab. Grace says an automated referral system leveraging electronic health records could help keep patients from falling through the cracks.
Say you're a heart patient with a stent or a bypass, we know that you benefit from rehab. So, you know, a flag comes up to the physician, you know, refer this patient to rehab. They just have to hit yes, right? And so it's top of mind, and we make it easy for them to do that, and then no one gets lost.
And Grace says an automatic referral system would mean that everybody who has a heart event or a heart procedure would automatically get notification that they are eligible for cardiac rehab and a referral to a rehab center. For your Fox Medical team, I'm Beth Galvin.